squeaking?
Mommy, I got first. Mommy, I got first.
I got you one.
Did you guys already do this?
Pictures.
Pictures, yeah.
You're gonna take your picture.
Pictures.
You gotta say cheese, though.
Say cheese. Say cheese.
Get started. A little bit of housekeeping. If everyone, and I'm usually the worst offender, could just turn their cell phones to silent or vibrate, that would be great. And are we streaming? Awesome.
Daddy. Daddy. Go.
It's going to play. Okay, we're going to get underway. Want to thank you for being with us today at OU Medical Center. We are very excited to have you with us. We are hoping to encourage adults, children, members of the community, pregnant women to join a new-fangled booster club, as it were. This booster club doesn't have anything to do with sports as we head back to school, and it has everything to do with protecting very young children from a potentially deadly disease called pertussis, also called whooping cough. Many people know it as that. Joining us today, we have Dr. Robert Welliver. He is OU Children's Physician's infectious disease specialist. And to his left, we have Dr. Landon Lorenz, and he is OU Physician's Obstetrics and Gynecology. We have the spellings of their name on this page if you're watching on streaming so that you can get the spellings there. And then we're also joined by a couple who have personal experience with pertussis. Their youngest, now 2 years old, Cullen, when he was only 5 weeks old, developed severe symptoms of pertussis and was in the hospital for several days. And that is Devin Galmore and Levy Galmore from Elk City. And with that, I'm going to turn things over to Dr. Welliver. He's going to talk a little bit about what is pertussis, how is it spread, why is it a concern, and why is it a problem for very young children, children under 2 months of age, and then also why vaccination, particularly boosters, can make a difference. After that, Dr. Lorenz is going to talk a little bit about a new recommendation for pregnant women to help protect their newborn babies. And then we're going to have Devin and Levy, if he wants to say anything, talk a little bit about their experiences. And then we'll show off the boys after we're all done with that, because she brought the boys with them. With that, Dr. Welliver, if you'll talk a little bit about pertussis.
Very good. So good afternoon. Pertussis is an old-time infection that's been around for as long as we know, and it's a bacterial infection that you inhale when someone coughs. They put the bacteria into aerosols in the air and you breathe them in. It's possible to pick it up off countertops as well, so you touch the contaminated area and then rub your eye or rub your nose and you can infect yourself that way, but usually by aerosols. And the most characteristic feature of pertussis is the cough. In an adult, that will go on for 5 or 6 weeks after you acquire the infection, and the adults will tell you, you just can't stop coughing. I mean, there's coughs, but the cough with pertussis is different from anything else. And you cough until you turn blue, you cough until you vomit, you cough until you pass out. And as bad as that is in adults, in children, in babies, it's even worse, as the virus, the bacteria enters the airway, causes inflammation and irritation there, and then other bacteria can invade that. You wind up with a secondary bacterial pneumonia. Sometimes you can wind up with an encephalitis from that, and most of the deaths that you see from pertussis are unfortunately in infants. So there are vaccines. There have always been, since the 1940s, there have been vaccines against pertussis, and the original, as it's called, whole cell vaccine was pretty effective, but it had a lot of side effects that you would get from that: high fevers, screaming all night after the immunization, and cold abscesses where at the site that you injected the pertussis, you get a large immune reaction against that, and you get a little knot in your thigh that was particularly irritating to have. So that vaccine's been cleaned up a great deal, and so there is an acellular, as it's referred to, pertussis vaccine that is good, and it's better in terms of fewer side effects, but it doesn't really carry the same efficacy as the first vaccine did. And so you do need multiple boosters to keep your immunity up, to keep it from falling off. And so the current immunization schedule is 5 in children once more before you go to high school, and recommended once before you go to college. And as Dr. Lorenz will tell you, also recommended during pregnancies now. So I guess that covers.
Dr. Lorenz, can you talk about the new recommendation for pregnant women and how what that will do for infants?
Right, so having our pregnant patients properly immunized is not a new thing. Particularly for pertussis, the recommendations have changed, recognizing the fact that this particular vaccine may not have as long-lasting immunity as other vaccines. And as we've seen more and more outbreaks of pertussis in the community, the only effective way we have to protect these newborn babies at their most vulnerable time is to adequately have those around them immunized. And we think that by immunizing pregnant patients late in their pregnancy, we can also deliver extra antibodies to the newborn that can be protective during those critical months.
When is the vaccine given to pregnant women?
We recommend that pregnant women get it between 27 and 36 weeks of pregnancy.
So that's in the 3rd trimester?
That's correct. The previous recommendations were for women to receive a Tdap during pregnancy, Tdap, tetanus, diphtheria, and pertussis vaccine during pregnancy if they had not been previously vaccinated.
And then I guess, Devin, we're going to kind of hand things over to you because I know you took a lot of steps to protect your baby because
Yes.
he was born a little early, and even with that, developed these severe symptoms. Can you tell us a little bit about what that was like as a parent to go through that? I'm sure very frightening.
Very frightening and very unexpected because we have, as new parents, we just really tried to protect our child and only get him out for doctor's appointments and, no trips to Walmart or anything like that. So the night that he, came down with it, it was just, kind of go through your steps. Okay, is this a cold? Is this, what is going on? And as he progressed just through the night and got worse and just wasn't breathing, and he had the coughing and he was choking on his cough, and you just knew your gut instinct as a mother that you needed to do something different. So that's why we brought him to Children's, because they deal with children every day.
You said to me on the phone that you've always been an advocate of vaccinations, but now you feel even stronger about that.
I do. I really, when I see new moms or new babies, I just really want to, give them my testimony and tell them, I hope you're vaccinating, and, to see your own child literally where you're praying and hoping that, he will come out of this just because of a vaccine. I mean, yes, I mean.
And your little baby couldn't be vaccinated. That's what people need to understand.
That's what they need to understand, that, if I were to be pregnant now, I would definitely talk to my doctor about getting the vaccination while I was still pregnant so that he would get, some of my vaccination. Because when I had colon, I got the Tdap shot after each of my pregnancies because I had a pregnancy before colon. And that in no way helped him other than the fact that I couldn't spread it to others.
So you were not sick.
No, I was not sick, and I knew that Colin wouldn't be able to actually get his first vaccination until he was 6 months of age.
So Dr. Welliver, I need to pass the microphone to you because I think some people get a little confused. They think these babies get sick because they were not vaccinated. These babies are picking it up from a well-meaning, potentially caregiver, relative, someone who's got maybe a persistent cough and just doesn't know they have pertussis.
Yes, I mean, they're carrying their mother's antibodies, as Devin was saying, through the first 2 months of life, and then they start to drift off after that. The mother recognizes that antibody as being foreign, and so their system will clear it, and so you need to immunize the infant to bring that back up. There he is here. So they're protected for that length of time, but you need to immunize them, and you need to continue to immunize them, and it's true now that adults get pertussis, and they need to be immunized as well to keep it from bringing it home to children. It's pretty clear that the most common number of cases you see of pertussis these days is in adolescents and adults. And in fact, most of the time that it's brought into the house, it's not brought by a school-age child, but by some parent relative that, just wants to see the child and hold them, but things can go wrong.
So if you have a cough, and you've not been vaccinated, then probably, even, I guess if you have a cough, you shouldn't be around.
Yeah, I mean, a cough is one thing, but if you've had the cough for 10 days, 2 weeks, 3 weeks, then you're much more likely to have pertussis. Probably ought to get tested to see exactly, what it is that you do have. But, I mean, a cough of any type, you really shouldn't be around small babies, because whatever it is that's causing the cough, it's not something that you want that baby to get, whether it's pertussis or whether it's just some common virus. But
We had a question sent in, and I think we've actually had two, and I think the first one, Dr. Welliver's for you, and then the second one for Dr. Lawrence. The first question was about herd immunity,
Mhm.
And why is that important for at-risk individuals? Could you first explain what that is?
what herd immunity is. So herd immunity is when you immunize enough of the population, you interrupt the outbreaks that occur, the epidemics that occur in that population. So, I mean, that works really well for polio, where you immunize people and so there's no transmission, but that doesn't work for respiratory viruses at all. So it's a great thought, and if you immunize 90% of the population against pertussis, you could make the outbreak smaller, and so that's good, but you can't eradicate it that way. I mean, everybody has to be immunized and up to date on their immunizations, and then you might be able to reduce the transmission to a substantial event. But I mean, you can't count on that. You can't say that, gee, the rest of the world's immunized, and so I don't need to be, and I won't transmit it to somebody else. I mean, I truly don't know how you would live with that if I didn't get immunized because I was a little bit afraid of the vaccine, but I got it and I passed it on to somebody else who had a serious outcome. I'm not sure how you justify that to yourself, but so it's better to just go ahead and go through. People are afraid of vaccines. There's been reasons to be afraid of vaccines from 50 years ago, but the vaccines now are much cleaner, they're much safer, and there's none of them that you really need to be afraid of at this point.
Can you very quickly explain what is a booster? We use that term, and I don't know that the public really understands what that means.
Yeah, so most vaccines that you get are inactivated vaccines, and you get an immune response that lasts for, 2, 3 years, something like that, and then the titers start to decline. So 5 years after, maybe 70%, 50% of people are protected. So you get another vaccination at that point. It boosts your immune system back up, and then you're protected for another 5 or 10 years after that. But currently, the pertussis immunization recommendation for adults is 1 lifetime vaccine. That will change, I'm sure, that as time goes on. That's going to be every 10 years, just like tetanus vaccination is.
Dr. Lorenz, can you talk a little bit about how, I think a lot of people think this is going to be the same as the flu vaccine, the influenza vaccine that pregnant women get, and you were saying there are some differences with how this will provide protection. Can you explain that?
Well, one of our main goals with vaccinating women and trying to get widespread vaccination coverage for influenza is that, as we saw in 2009 with the swine flu epidemic, pregnant women are a vulnerable population, and we saw lots of deaths during that outbreak. And even in this year's flu season, we've seen a lot of serious respiratory complications in pregnant patients. And so while we want the influenza vaccinations to protect the newborns as well, it's very important to us to protect the pregnant moms. With whooping cough, we want to protect them against that too, but it's really a first line of defense for the newborns, preventing infection. And not only are we recommending women to be vaccinated for pertussis in each pregnancy in the 3rd trimester, we're also encouraging to have the household members, caretakers, grandparents, anyone who's going to be in contact with these newborns to be vaccinated as well. And we call that cocooning, so hopefully we can create an area of protection around these newborns during those vital first months.
The question that came in asked about outbreaks. Once an outbreak has hit, and there are several parts of the country right now having an outbreak. Nationally, we're up about 24% over last year, and I checked with the state health department. There have been 65 cases this year, so we're not necessarily in an outbreak here. But they want to know, once an outbreak occurs, is it too late to be vaccinated?
Well, typically on pregnant women, we want to vaccinate them in that 3rd trimester to get that antibody boost we talked about. However, the recommendations do change if we're in an epidemic of pertussis, and so Once that decision is made, we would recommend that vaccination occur at any time during the pregnancy to prevent exposure.
So you might vaccinate earlier in
Right.
an outbreak in those states. And then what about for the community?
No, I think for, influenza, they talk about there's such a defined season every year, so there's a finite period of time where vaccination's going to help. For pertussis, it goes on for years, and so any time is a good time to get vaccinated against that. Even if the epidemic's been around for a month or 2 or 3, you still want to go ahead and get your booster at that point to protect yourself from that, because it could go on, indefinitely, really.
It seems like this pertussis in adults is not fun. I mean, is a yucky, miserable disease. Why is it so dangerous in infants?
Oh, it's dangerous for everybody. I think it's more dangerous for infants because your airway is so much smaller and your predisposition to get bacterial secondary infections is greater as an infant than it is as an adult. So, an infant can't put up with coughing that long the way that an adult can. An adult can't either, really, but an infant definitely can't. And then there's your immunity to bacterial infections as an infant is much less than it is as an adult, and so you're prone to have the, life-threatening complications that, their child actually had.
He couldn't move it, like when he,
Yeah.
couldn't breathe and he wasn't able to cough it or move it where they had to suction it on out.
Right. Yeah.
An infant's not able to open up his own airways after getting choked and coughing.
Right. Yeah.
And Devin, you said there was a particularly frightening moment when he just stopped breathing.
Yes, like his heart rate was dropping, he was struggling. I mean, it was very, very scary. And the nurse came in and, you kind of broke it up off of his, had to hit his back to break it up some more, and then took the suction and suctioned him out because he was just filling up with so much fluid that he wasn't able just to bring it on out.
And Devin, when you look at him now,
I think I'm going to be in a big trouble, big trouble. I like when I can hear him. When I don't hear him is when I get very nervous. Yes, and I really, truly, but my positive out of him being so sick is that I'm able to help other families and help other mothers. And I have friends I never knew I had on Facebook, and they'll, ask me, oh, my baby's doing this, this, and this. And I say, as a mother, something's wrong. Go with your gut instinct. Children's was amazing with helping us. They listened. They handled children every day. They knew what to do, and they acted fast. And, and that's the thing. We caught it early with him. We saw the symptoms. We saw the signs. So we jumped right on top of it. And that's what all of our doctors said, that was key in helping him, was that we had the early signs. And I was telling earlier that it is neat to see also on Facebook that other mothers that are my friends who are actually in their last trimester and that are pregnant are actually getting the Tdap shot to go ahead and help their babies. And if I were expecting again, I would be right on board with that. It's just neat to see.
What's your message to people in the community as well?
Well, you may not realize that you are going to be out amongst a baby. Some mothers are just clueless about the disease, and, you yourself may be an older woman and be around Walmart and not know you're going to be around a baby. And what if you did cough, or it was on the shopping cart and a new mother came in with a new baby? You just never know when you could actually help save a life. And you might not know you ever did, but getting the shot, you would just be protected. And just like for younger teens and at school and things, I don't know if parents are really aware that they need that booster right in that area. And, you never know if, someone's going to bring a baby up to school and you're going to be around one. You're just automatically drawn to a baby. If you're going to touch it or be around it, get the shot.
I know this is a strange question, but it seems like we think about vaccinations when we're in that particular, going for those regular well-child visits.
The first couple of years.
In the middle school and high school years, if they're not playing sports, sometimes you're not getting to the doctor's office every year. So, Dr. Will, for both of you, is this something you need to be aware of? And for pregnant women who have teenagers, they also need to be aware of that these kids may need a booster?
So the most common age group to see pertussis these days is adolescents and adults, and so that tells you do need to come back and get your immunity boosted so that your child doesn't get it, that you don't transmit it to somebody else and they transmit it to their child. So yeah, you know, you're young and healthy at that point. You think nothing can happen to you, but it's not just you that you're protecting the rest of the community as well.
You said eventually this could end up being a vaccine like tetanus, correct?
I think it will. I think all the evidence that we get is just there's no age group where you don't get pertussis. That's an illusion we were under for, 20 or 30 years. But, as there are better tests, and as we're more aware that older people do get pertussis, now you test them, you find out how often you actually get it, and you see how quickly the immunity drops off after a vaccine. So I'm sure there will be a time where you get pertussis vaccinations every 10 years.
Why are we seeing these outbreaks in communities where, I know in Massachusetts, it's pretty headline, in California, it's like all of a sudden they're in the midst of, and I know New York City was hit really hard just a couple of years ago with one baby dying, and then Cullen was at the hospital, and that's a small community. Why do these things occur?
It's a combination of things. I think that pertussis, even long ago, always, when there was no vaccines, there were epidemics of it every 4 or 5 years. So you'd have certain years where you'd see more activity than others. I'm sure that that's still true. That's the nature of the organism itself. But as you have more and more groups that, for their own reasons, and I'm not challenging their reasons, but decide not to be vaccinated, whenever you do that, inevitably you see an increase in the number of cases and in the complications and severe cases from that. So, I'm not going to argue religion with people today, to be sure. But when countries have done that, when they've been concerned about autism, or they've been concerned about pertussis encephalopathy, and you stop immunizing, you invariably within 6 months see an uptick in the number of cases and in the severe complications from that. So some of it's that. The tests are better, and so when you test people, you can find cases that you missed before because the tests weren't as good as identifying it. And we know that there's pertussis in adolescents and adults, which we didn't understand before, and so we test them and you find cases. So there's lots of things that come together to account for that.
Can you address the potential side effects? The new vaccine, and that's one of the things, there were headlines about the older version
Right.
of the vaccine. With the newer vaccine,
Yeah, so the older vaccine, you would get occasional child, well, maybe 20% would have one of the things that I will tell you about, where you screamed all night and you're just agitated and very, very unhappy, and the next day you were kind of okay. They would get fevers from that. They would get reactions to the injection. I remember my son getting this, in fact, where like he was just standing in his crib holding his leg up, and you could see this big red mark around where he had got his immunization. So essentially none of that happens with the newer vaccines. They're not quite as effective, and so you do need boosters from that. They're not quite as potent in terms of inducing protection, but they're way less in terms of side effects from that. So there isn't a vaccine that's made now where there's a real reason to be afraid of side effects from that. They're so clean, they're so refined now, and the mercury's been taken out. There's minimal amounts of formaldehyde. There's none of those adjuvants and things like that that people are concerned about causing problems in them. So while there's been some reason to be afraid of vaccines, it's way overdone. They're very safe, and there's been nothing that's happened in pediatrics in my lifetime that's had the enormous effect on child health that vaccination has had. It's the right thing to do.
I guess the last question, we have certain diseases, respiratory diseases like RSV, that only occur, they seem to occur more in the winter.
Right.
Pertussis seems to be all year.
It's all year, yeah.
It's
yeah.
around all the time.
Yeah, you see maybe a little bit more in the fall, but it's definitely around all year.
So you can be exposed and your baby can be exposed,
Yeah, yeah.
potentially.
Yeah.
Final words, I guess, from any of you as to, kiddos are heading back to school, which means they're gonna be around a lot of other kiddos. The community, I know there's a risk in the community as well when you go out. What would be your advice to those watching this?
Well, I'd like to make one additional comment about people being afraid of vaccines. And, certainly our pregnant patients are very concerned about what they're putting in their bodies. And I want to reiterate that, our professional organizations, practitioners, we are very comfortable that these products are safe. And there hasn't been any evidence to suggest that they aren't. Adverse reactions are extremely rare, even in pregnant patients. Most of our vaccine formulations don't even contain the thimerosal anymore, so the mercury exposure, even with thimerosal-containing vaccines, is not thought to be harmful to pregnant patients.
So pregnant women who are afraid even to take a Sudafed can feel comfortable getting this vaccine?
Absolutely.
Okay. Dr. Welleberg,
Yeah, just pretty much what I said is that I know that people have their reservations about vaccines, but I can tell you that the science behind that is that, yeah, babies can handle this much exposure to antigens. It's better for them. They come out ahead if they're vaccinated, and it's been proved time and again. The autism thing doesn't exist. The mercury poisoning thing doesn't exist. The formaldehyde poisoning thing doesn't exist. None of those really bear up. I mean, they've been studied many, many times in the States. And the other thing is, like, when other countries stop giving these vaccines, they start seeing the disease again and the complications again, and they go right back to vaccinating. So it's the right thing to do. It's not that scary, and it's just the best thing for your child.
Devin, oh, go ahead.
Good question, yeah. I mean, I get that pregnant women and children, and if you have small kids, but I don't need to get a booster shot. Do I? I don't have, my kids are grown.
Yeah, well,
Yeah, you do.
You do. Actually,
Yes, you
yeah,
do, because you're
yeah.
around my kids today.
Yeah. The most cases of pertussis you see are in people your age and younger, and so there is a risk. And you say, well, I'm not going to get it, but I mean, how do you know? I mean, you go out to the Thunder game or something like that, how many people are around you, and you don't know that any of them doesn't have, the guys next to you is coughing a little bit, you don't know if that's flu or not. And the other side of that is that when you look at families and you see who brought it in, it's like a relative, a parent, something like that, like, you know, you and me, that, you know, you don't know any better. If you did, you certainly wouldn't expose them, you know, but you don't know that
want
you're going to.
exactly.
But you do. you know,
Or waiting in line
so-
at a restaurant. I
Yeah,
mean, you're going to be
yeah.
around children and not even realize it.
Exactly.
And
Yeah.
young adults,
Yeah.
since those are the carriers.
This is really this booster's for everyone.
It
I'd
really
like to
is.
make one addition to that. I mean, it's been recommended for a long time to get a tetanus booster, and tetanus doesn't get a lot of attention anymore because we don't see cases very often. But how many people haven't had their tetanus booster in the last 10 years? And that would be an excellent opportunity to receive the Tdap instead of just the tetanus booster.
Yeah, I got Canadian County Health Department gave me a tetanus shot last year during the Moore tornado. They were going around giving free ones to everybody. Would that have been just a tetanus shot, or what you're talking about, the Tdap?
I suspect it was probably just a tetanus booster,
I
but
think you have to ask for it.
Yes.
You have to ask for it.
Everybody, everybody, I feel like everybody knows you need a tetanus booster every 5 or 10 years, but this is the first I've heard of this.
And that's one of the reasons we're doing this, and I just have to compliment this family for stepping up, because you not only know the positive outcome because your son survived, but
Yes,
you
thank
live
God.
in a community devastated by the death of an infant.
Yes, I mean, we see both sides of it. We see a family that is mourning the loss of their child, and then you see our side where we're praising God that our baby pulled through and lived. But it just always goes back to those early signs, the early symptoms, and just knowing that something was wrong.
I would say that's it. The biggest deal is the awareness, because before Aiden's story and Cullen, I had never heard anything about the Tdap shot or.
I just knew I got it
pertussis.
after I had the kids.
I mean, it was never spoke up about till after this had happened. And if it was spoke up and the awareness was bright and everybody knew about it, I don't feel like this stuff would have happened.
Levy, you're this big tough dad.
Try to
and
be.
quiet mostly.
Yeah.
Do you mind moving the microphone over? Because I just got to ask you this. Because guys aren't the ones who typically go to the doctor's office. And there are probably a lot of guys your age who probably think, I don't need that shot. What would you say to them?
It's different when it involves your child. It kind of hits a different spot on you. When that little baby that's 5 weeks old is sitting there and you can't breathe, and if you don't get the sense of trying to cough for that child, there's something wrong with you.
So do you tell your friends?
Our company, when they found out about Cullen 2 years ago, our company and multiple companies in Elk City basically shut down. Everybody went and got the shot.
They actually ran the health department out of vaccines after we did our first initial story. And then we just know so many people around the community and here within the city, and they just reached out, they called us, messaged us on Facebook, and they did the same thing. They shut their companies down, went and got the shots. So, I mean, it was very heartwarming to know.
There's a large machinery company in Oklahoma City that I told them we were going to do this update on the story, and he said it was one of the best stories they had heard, and it moved a lot of their employees to go get the shot. I don't know how many, but it's a large company.
great story. It's very reassuring to see that people are getting the idea from that. And I'd say the other side of this, if there's business people listening, I mean, it's a cost-effective measure to do that. I mean, the cost of vaccines is pretty small. The cost of paying insurance for a child that gets this and winds up in the hospital on ECMO, 3 or 4 months in the hospital, it's a huge amount. And so, I mean, the cost effectiveness of vaccines has been proved lots of times, so it's something you should be urging your employees to do.
And can you just clarify for me, how is this spread? Is it through the droplets that they're coughing?
It's primarily through, they cough, they put droplets in the air, and then if you're within 6 feet of them, you inhale those and they land in your own lung. You can pick it up by, if someone's coughed on a flat surface and you touch that and then you rub your eye or rub your nose. So what you learn from that is don't touch your eye and don't touch your nose and wash your hands frequently, even with the alcohol rubs and things like that. The breathing, you can't do much about that, so that's what I mean, is it's just gonna happen. It's gonna spread no matter how hard you try. And so no matter how immune you think that you are, you're not, and you can be responsible for spreading it, and nobody wants that.
Well, I thought we might get the boys up here.
Okay.
And let the cameras.
Carson, Kel, Cullen.
Just put the cameras on them, it would be great. You can sit and-
Business-like.
Come on, Kel.
I learned a lot from you.
Come
You
here,
did
Kel.
very good.
Thank you.
Speaking
You're
very
great.
well.
Yeah, you do.
Oh,
You're
thank
good.
you.
This is wonderful what
You
you're
have
doing.
really large hands.
Yeah, I guess this is great what you're doing.
Well, thank
You're
you.
helping other people that are in the same
That's what I'm
position.
hoping we're getting it across,
Yeah.
that, because even as a new mom, once I do my first initial shots, I didn't realize, my children, as they hit the teen years, I mean, we need to go again, and, and I knew us as being around babies, but I didn't know they could be such carriers too afterwards.
5 weeks, I
I
think.
think for a mom who's unsure about it, to hear it from another mom, it's a little different than you.
Say that again.
I literally, honestly have someone off of Facebook reach out to me, and I've had
asking
parents
a question.
and mothers ask me, like, is it okay to vaccinate while I'm pregnant and all that, So I said, yes, I've researched it, you're good to go, you just, coming from a mom that has seen it, I mean,
Yeah,
like you
exactly.
said, you're just helpless watching your child, and then the misconception of, well, why didn't I do something about it? Well, I couldn't at that time.
Yeah, and that's really unfortunate that people take that tack with you and stuff, but.
What's your favorite color?
Yeah, we've always said, like, if you don't believe it, come down here and watch some of these kids struggle with their diseases and stuff. Don't change your mind about what you
Any
do.
of the diseases.
Or yellow.
Yeah.
In our little private preschool at home, there was 8 children that their parents didn't believe in vaccinating. And it's like, well, I don't want my kids in that house.
We see it
Yeah.
all the time.
Yeah,
It's clean, organic.
Okay.
Give those to mom.
Okay.
You're not gonna change your mind, and the more you
Yeah.
try, the more
Yeah,
they're
yeah.
fortified
I mean, they are
against it.
set on it. They've
Yeah.
heard one story off the internet, who knows if it's true, and they're
Yes.
going with it.
yeah, exactly. It's not rational at all. So, yeah, you can't reason with them.
It's very
not.
frustrating, especially where we've been at. You're just like, oh,
Yeah, yeah.
I mean, you look at the flu vaccination rates in pregnant patients, it's 40% for this year.
this year, like
And
this
I
year,
mean, a lot of it is, in the hands of the physician, not
pushing
bringing
or
it up
bringing
and
it
pushing
up.
it as much.
It's just like when they give
I think a
nipples.
good percentage is people not, there's just this huge vaccine, anti-vaccine thing that's difficult to
Yeah.
deal with.
After each of my 12 kids, they didn't tell me what that shot was for. They just said, oh, you probably want to do it.
Yeah, they should.
They didn't explain it out,
yeah.
and I had them 4 years apart. So you think by now, but
Yeah.
now maybe it's different. Maybe
Yeah.
they tell me
Jeez.
how the importance of it. And
Yeah, it's
they
more
need to,
different.
they need
than
to
it
bring
was
video
before.
around and show video of Colin struggling to
Exactly.
breathe.
Exactly, yeah,
They have done
yeah.
it, and there have been studies that have looked at doing things like that. If it
Really?
changes the people's minds who are anti-vaccine, and it doesn't.
Just even like that, what is that one rash viral that's the Rozier?
Rotella.
Yeah, like that virus alone. It's like, come on, people, this
yeah.
takes lives. But they think that that's one and how many is probably
Yeah.
what they're thinking.
Or they think, chicken pox, we had that when we were kids.
Yes,
Yeah.
yes,
What's the big deal?
Yeah.
that's the big deal.
Yeah.
Why?
Yeah. No, I think what he's saying is, like, you get companies to say, like, the guys are gonna do this, or we're not gonna keep you, working here and stuff. Yeah, that'll do it. If you wanna eat,
Well, that was kind of like with our oil field company. I mean, we had 200-300 people at times, and they all got the
Yeah.
vaccine.
Yeah.
My dad owns the John Deere dealerships in Clinton.
We buy from him. We have a
Keep
arrangement.
that up. But anyway, every winter, the doctor was coming to the dealerships with flu vaccine.
Coming on in. Coming on in.
Okay.
Okay.
Yeah.